Welcome to Dental XP. In part 3 of this 4-part series, we're going to uncover an implant placed in a previously augmented maxillary left incisor ridge defect. As you will recall from parts 1 and 2, this area was grafted utilizing BioOs collagen and a collagen membrane, and then at second stage, placement of the implant into the grafted bone, additional bone grafting was performed to ensure that labial resorption of the grafted bone would not take place after implant placement. A tissue punch was utilized to expose the top of the implant, and the cover screw of the implant was then removed. At the time of uncovering, because of good initial stability of the implant, an immediate permanent abutment was selected for the implant. You can see that this abutment is a HLA contour abutment from Zimmer Dental that was secured onto the top of the 3.3 millimeter diameter implant, and the temp base cap, which comes with the abutment, was then inserted over the top to ensure good stability and fit of the pre-contoured margins of this abutment. This is an anatomically shaped abutment, and then what we went ahead and did is placed with a quarter round burr small undercuts in this temp base cap to ensure that a mechanical lock would take place when we went ahead and relined the polycarbonate crown over the top of the abutment. What's nice about this system is that we have 3 different levels of gingival heights, 1, 2, and 3, and then the collar of the chamfer is lower on the buccal and higher on the palate. We then went ahead and painted monomer onto this temp base cap to fill in these undercut holes, and then placed acrylic resin mixed with monomer on top of this acrylic cap. The excess material was then gently removed, and the temporary restoration is removed in approximately 3 to 4 minutes with the temp base cap inserted. And this temp base cap, as you can see, ensures that we have a good seal of the chamfer margins before we go ahead and finish the temporary out of the mouth. A simple vertical mattress suture is then done onto the mesial papilla, and barricade is then placed over the screw access to make sure that no cement will be placed into the screw access. This is light cured periodontal packing material, which is secured. We then test the temporary restoration in the mouth to make sure that it fits and that there is good retention. One of the nice things about having a temp base cap to ensure that the margins are sealed is that we have an excellent retention without having to utilize conventional dental cement. What we utilize at this stage is simply an antibiotic paste such as acromycin or Arestin or dentamycin. You can see that we under-contoured the subgingival aspect to make sure that we don't strain the labial tissues during the early healing. So some of the most important factors is to seal the margins, which we do so with this system with a temp base cap. We then under-contour the subgingival area of the temporary to make sure there's no strain on the soft tissue, and that we have a good seal and fit utilizing the antibiotic paste. At approximately 3 weeks, the patient came back in because the temporary started to get loose with just a temporary antibiotic paste. So in order to cement it at this time with the epithelium now healed, we can go ahead and utilize conventional temporary cement. You can see again how this fits in the mouth with the under contouring. And if we go through the progression from part 1 with the bone graft, collagen, BioOs collagen, part 2 with the implant placement, and then of course part 3 with the uncovering and the placement of an HLA contour abutment. looking at nice shaping of the soft tissue at as early as 3 weeks, the under contouring of the subgingival aspect of the temporary restoration, and you can see that the lateral incisor on the left side now quite aesthetically pleasing, and we can go ahead and proceed in part 4 with the final restoration of the maxillary left implant supported crown in combination with some cosmetic dentistry, which will be performed by Dr. David Garber on the maxillary right lateral incisor and right central incisor. We look forward to seeing you for part 4, and once again, thank you from Dental XP.